We're going to talk about um, healthcare promotional models and behavioral change. And when you think about this, you want to think about different theories of how these models came into play and how each one can be applied. So when you think about first one, health belief model, this was developed by Marshall Becker. And in this model, why people avoid prevention program despite knowing risk. That's what this model talks about. It highlights the role of perceived susceptibility and perceived severity, perceived benefits, barriers, and intervention strategy. When you think about susceptibility, you want to think about, like, let's take a scenario. A 50-year-old male comes in for colonoscopy, like, is advised to get colonoscopy for colorectal cancer screening. Now, when you look at this model and apply it to this scenario, you can think about each section like this. When you think about susceptibility, you can think about he doesn't believe that he's at risk because he feels healthy. So that is perception of susceptibility. When you think about perceived severity, he thinks colorectal cancer is serious, but assumes that it is rare. So he thinks that he doesn't need the testing. Perceived benefits. He does understand that this one early detection saves lives. Now, perceived barriers. He fears the procedure and the cost. Now, a doctor educates him on statistics on higher survival rates with early detection and reduces the fear through and offers insurance options. So, in expectations of efficacy, there are, like, they think it's better or not better or good or helpful. So these are all the things which are playing a role in prevention, like explains why healthy people avoid prevention programs. These are all the thoughts which they go by. So that's the health belief model. Now, when you think about transtheoretical model of change, this was described by Prochaska, Norcrask, and De Clemente. There are 6 stages of change. One is pre-contemplation, where there's no intention to change. You can apply this in substance abuse. So for example, let's say that you talk to somebody about wanting to cut down alcohol or stopping drinking. They can be in different stages. Which stage is the patient? That helps. So pre-contemplation means there is no intention to change. Contemplation means they are thinking about change. Preparation means they are planning for action. Action means taking steps to change. So these are all the stages of uh, some of the changes. There are 6 stages, but we have like 4 listed here. So you want to understand which stage the patient is in. The other stages are like preparation, where it comes under after contemplation, and then action. Then there is maintenance, and then there is termination. So these are the 6 stages, fourth and fifth. So pre-contemplation, where there is no intention for change. Contemplation, where they're thinking about change. Preparation is they're planning to take action. Action is they're taking steps and they're maintaining. And then behavior change is permanent. Okay. So now let's say, think about this in a smoker, like somebody who is doesn't in the patient does not want to quit. Now they think that smoking is bad and quitting sounds hard. Then preparation is they're buying nicotine patches and sets a quit date. Action is starts reducing the cigarette intake. And then maintenance is remain smoke free for 6 months. Now there is no temptation for relapse. So, and that's that. Now let's go to like motivational interviewing. And in motivational interviewing, it is developed by Miller and Rolnick. For exam, I don't think that they will ask for like who created it, but this is a client-centered approach that helps patient resolve ambivalence towards change by using empathetic communication, open-ended questions, and reflective listening. So you can think about um, this in a way that it's client-centered and elicit motivation from the patient. Non-confrontational helps resolve ambivalence. So think about a scenario where a patient is obese and is resistant to dietary changes. Your approach should be like, what are your some challenges you face in eating healthier? I don't have time to cook, the patient says. Then you feel fast food is your only option? Yes, but I know it's unhealthy. So what small step could you take towards healthier eating? Maybe I could meal prep on weekends. So I think you're guiding the patient about meal prep and things like that. Now, let's look at another theory, which is self-efficacy and social learning. This was created by Bandura, and in this one, the behavior is influenced by cognitive and environment factors. That means that people learn by observing others and are more likely to change behavior if they believe in their ability to succeed. Now, the key concept are observational learning and self-efficacy. Observational learning is learning by watching others, and self-efficacy is confidence in ability to perform. So, a person wants to start exercising but lacks confidence. And self-efficacy strategy, the watching videos of similar fitness level succeeding will help him win. Celebrates small wins like walking 10 miles, then he gets. So either by observing others or confidence in ability to perform. So you go to gym, you see other people working out who are in similar fitness level, you get motivated. You go and do a 5 mile run with a bunch of people, then you get motivated, things like that. So let's look at other things now. When you think about this integration and clinical applications of these models, you want to think about health belief model. It talks about why people avoid prevention. Motivational interviewing techniques to move patients forward or clients forward. Transtheoretical, you think about where they are in change. Self-efficacy theory, importance of confidence in change. Now, what are the clinical beliefs? You can use this model based on the patients, like think about assess beliefs, stages of change, and then self-efficacy, where how much they are motivated internally. And use empathetic, supportive, and targeted strategies. Match interventions to client current stage and beliefs. So you want to use these theories to understand what elements of each theory you can apply to a certain patient based on stage, based on perception, their beliefs, and their level of motivation, and all that. Hope that helps. Thank you.